COVID-19 infections in the country continues to spike. A number of state agencies have been affected by the transmission, with some even closing down operations. Zainab Mohammed has the details.
Over 100 days since Kenya recorded its first case of the novel coronavirus, infection rates have continued to surge, with government offices not left behind in the COVID-19 ravage. Offices in the Ministry of Lands, the ICT Ministry, the National Treasury, the Judiciary, Parliament buildings and even the Public Service Commission offices are reported to have been affected, some even closing their doors or downscaling their services. The Ministry of Health now warning that these cases in workplaces will continue to be reported if Kenyans will not take proper precautions in the fight against COVID-19.
The virus will find itself in many places. Public offices, high offices are not an exception. We will continue to see many different places where we will find that there are cases of infection, that there is spread of infection, and we need to be able to move in quickly and try to stop that spread of infection. So if we have today infection cases at the ICT offices, I think it is not a matter of surprise, it is an expectation.
The government is further appealing to NHIF and other private insurance service providers to review their policies and accommodate the effects of COVID-19 pandemic to its beneficiaries in matters such as covering the payment of COVID-19 testing that is proving to be unaffordable to most Kenyans.
NHIF, the entire insurance industry, I think is in a situation where they have now to look at and review their policies, because coronavirus was not there before. It was not there when the policies were set and the exclusions and inclusions were set. I think it's a process now of reviewing this and seeing what it means, what the implications are in terms of cost and what can be covered. But I can tell you that these discussions are ongoing, not only with NHIF, but also in the private insurance industry.
The number of COVID-19 cases in the country has risen to 11,252 after 461 people tested positive in the last 24 hours, and it is spread across counties.
Patikana, Nairobi ina watu 248, Machakos 97, Kiambu 20, Kajiado 15, Migori 14, Busia 12, Nakuru 11, Laikipia 7, Nyeri 7, Kilifi 6, Lamu 4, Wasingishu 4, Kakamega 3, Kisii 3, Kisumu 2, Makueni 2, Mombasa, Taita Taveta na Bomet 1 kila county.
In counties' preparedness, the Council of Governors says counties have continued to progress towards the right direction. In a statement to newsrooms, the council says in total the counties have set up 271 isolation centers with 12,034 beds, 447 ICUs and 437 ventilators. Elsewhere, all National Assembly committee sittings will only be done virtually as from Tuesday, July 28th. This is according to Speaker Muturi, who ruled that all committee sittings remain suspended until the said date, when necessary measures will have been put in place to accommodate virtual meetings. For TV47, I'm Zainab Mohammed.